Yeah, Andrew, thanks very much. Great pleasure to join the National Core Studies Symposium. It's been an amazing contribution to the way science has started to change the course of the pandemic, and a huge tribute to everybody. Just pay enormous tribute to everybody that's been involved: scientists, science itself, the public, patients. Also, like to just pay tribute to civil servants across the country who have done a truly remarkable job, and I think often goes unrecognised and underappreciated sometimes. So, to all civil servants in the audience who have played such a critical role, thank you very much on behalf of everybody. So, COVID is I think um, a symptom in a way of an era that we're living through. An era I think goes back to the turn of the century. In fact, just before it, to 1998, 99, with an outbreak of something called Nipah virus in Malaysia, and a series of epidemics since then, which have become increasingly complex and increasingly and more frequent. And the reason for that is because the key drivers for the start of epidemics and then for their spread are all key drivers of our era, and they're going to be there throughout the 21st century. And that is why I think we need to be cognizant that these epidemics are going to become more frequent. And those drivers are in no particular order, but they're ecological change, their environment change, their change of the climate, change of human-animal interfaces. Most new viruses and re-emerging viruses and pathogens come from the animal sector. And of course, we then live across the world now in huge cities, which allow amplifying of epidemics, and then trade and travel allows their dissemination around the world in record time. All of those are going to be drivers of this century, and therefore we have to be aware that we are going to face more complex and more frequent pandemics, and they will occur at a speed as we've seen over the last year, and they will cause enormous disruption, as we heard in that opening video. I think I frame it in four concentric or overlapping circles. There's the direct health impact of COVID itself, which has been devastating. But when you disrupt through COVID, you disrupt the rest of healthcare, both prevention and treatment. So the indirect consequences on health are significant. And then we have a disruption of everything else in society: education, opportunities, economics, trade. This will be the biggest impact on the economies of the world outside wartime in the last 100 years. And finally, geopolitics will be affected. And geopolitics, I'm afraid, the pandemic happened at a time when geopolitics was stretched and strained, east-west, north-south, and I'm afraid that is likely to continue to reverberate even as we hopefully come through the worst phase of this pandemic. And in addition to that, pandemics happen in the context of a changing world generally, changing demography. Age profiles of society is changing, inequality, which has been so starkly brought through during the COVID. And of course, not just epidemic diseases, but endemic infections, drug resistance, and the continued challenge of dealing with that demographic shift, multimorbidity, and all of the other aspects of health that people are all on this call working on. And one of the defining things, I think, of this pandemic has been that the capacity you have in place before a pandemic hits largely determines your ability once a pandemic, or an epidemic indeed, disrupts your usual systems. And I think that also points to the opportunity that we need to grasp. And the National Core Studies, I think, is perfectly placed to try and now do this in this country, because it is, as Andrew said at the start, not the isolation or the fragmentation of these activities, it's the bringing them together that makes the difference, that allows you to both respond to the other health challenges we have, but be in a better place to respond when inevitable crises hit. And I've chosen 4 or 5 of these, which I think are critical to take out of the National Core Studies and take forward. And that is surveillance, the start of understanding how things are changing, whether in endemic infections, epidemic infections, or non-communicable diseases. Understanding what is the health of the nation, and therefore broadly the globe, is critically important. And that starts with good data from public health, from clinical medicine, from intensive care units, and all together as surveillance. And that surveillance has to, I think, come into the 21st century and embrace modern data flows, genomics, and put that together, and not see this as a fragmented technology of the 21st century versus 20th century approaches to public health. So I think there's an opportunity now to bring those together in a better way. we've seen through the recovery trial in this country just the power of really well conducted clinical trials. And again, if you'd asked me 5 or 6 years ago, I'd have said that clinical trials for epidemics on a shelf was good enough. I no longer think that. I think clinical trials have to be being done at scale in an integrated way, linked with surveillance all of the time. And again, bringing benefit all of the time, not just to epidemic diseases, but to all of the other health conditions where we need to provide answers to still unanswered questions. And having that clinical trials capacity in this country through the National Institutes of Health Research and the NHS was absolutely central to allowing the recovery trial to deliver what it did deliver. Vaccines have been absolutely game-changing for this pandemic, alongside the other things I've mentioned. And I think the advances in science, and this country has played an absolutely pivotal role, but so have many other countries around the world, Germany, the US, Cuba recently with vaccine development, China as well, and of course India with its manufacturing capacity. But I think we're going to see advances in science, not just for vaccines, but through the adenovectored of the Oxford AstraZeneca trial, but also the mRNA approaches, which are going to, I think, transform vaccinology in the future. But also, I think there will be a blurring of the margins between what we call a vaccine and what we call a therapeutic in future. And we need to be able to take forward that technology. We're in the first generation of that technology at the moment, and I think that is incredibly exciting. And this is an issue in this country, but it's an issue around the world as well. We have to then have the health systems that can deliver these things in an innovative way, at scale, use the best data, and make sure that that data is available and trusted by everybody. Trust in society of science and trust of the scientific methods, the scientific messengers, and the way science can improve our lives is going to be absolutely critical. Because again, if you look at all of the great challenges that we face in the 21st century, and I've mentioned some, science is going to play a critical role in addressing many, if not all of them. But if that science does not reach society, and if society does not trust that science and the data behind it and everything else, then I think we will not allow the scientific advances to lead to the greatest advances for the maximum number of people globally. And that comes to the last point in this list, and that is around governance. I'm sure Patrick will talk about policy and decision making and how science feeds into policy making much better than any of the rest of us could. But how science is governed, how it's fed into policy, I think is something, again, we must reflect through and after this pandemic of how we can do that better. All of this, in my view, has to be active and has utility all of the time. I don't think you can have these things waiting in the wings for an epidemic to start. These things have to be tested, they have to be used, they have to bring utility all the time, because if they do not, I don't think they will receive the financial support, I don't think they'll receive the scientific support, and I don't think they'll receive the support of the public if they're not providing utility all the time outside and not just for epidemics. And finally, in the last 30 seconds or so, this country has now got itself into, I think, a remarkably good place with the rollout of the vaccines, and everybody involved deserves enormous credit, even in the context of now the Delta variant taking over. But we should just remind ourselves that the rest of the world is in a very, very different place, and we are at grave risk, I think, of moving into a very fragmented world with new variants coming, which will come back to haunt us all in the future if we don't break down the fragmentation and the vaccine inequality. Vaccine inequality now effectively defines the world and its COVID situation. And anything we can all do to encourage the sharing of vaccines as fast as we can, the manufacturing distributed, will be in all of our self-interests. It is enlightened self-interest to bring the pandemic to a close. Andrew, I think I'm handing back to you. And again, thank you very much for the invitation.
Jeremy, perfect, fantastic framing of where we are now in the context of the prospect of more frequent and complex pandemic. Just a beautiful framing for the day.